Welcome back to Secrets of Beauty and Wellness. I'm your host, Dr. Kimberly Ayala, and with me today, I have Janitza from D-essence in New York, is it?
That's D-essence Wellness. Hello, Kimberly. How are you? Thank you for having me here.
Where in New York are you?
I am in New Windsor, New York, upstate New York. I'm about an hour and a half from New York City.
Somewhere in the cold weather.
Yes, absolutely. And you're enjoying the nice warm weather over there in Florida.
So,
Yes.
how did we meet? I don't think we talked about that.
Right. Yes. So one day I was scrolling and I saw you talking about the perfect derma peel. And then I saw you again talking about hormones and weight loss. I said, "Oh, I love her." So I said, "Follow." And then, one day I'm very talkative and I just send you a message. I said, "Hello, how are you? I enjoy everything that you're doing." And then we started taking courses together with Empire Medical.
How crazy is that with social media can literally bring you people that you had no idea are going to help you grow as a business and as a woman. That's just crazy, I think.
Absolutely. I think this, platform opens new friendships and networking because it's very important to have networkings in this arena that we're practicing in.
100%. I love networking with everybody because that's honestly how you grow. Not even just as a business, but like, what are they doing? Oh my God, she does amazing fillers. Let me learn with her. And that's how you keep growing and learning and evolving in this industry. Because, like I was always telling in social media, if you're not educating yourself all the time, what are you doing on this industry?
Right. And it's very important to, celebrate others and empower, especially women who own a small business, because it's important to cheer others that they're doing very well.
Talking about education and how important it is to go to an educated injector in this industry. Since you're out there in New York, did you hear about this esthetician in New York that went to jail because he was injecting fake Botox to his patients, and a lot of his patients end up in the ER with botulism-like symptoms?
Yes. So, this is a big issue that we're facing in this industry right now. There is a lot of talk about a lot of significant issues that can occur with fake Botox fillers or no trademark aesthetic medicine, and it is very important for the consumer to educate themselves to look who are you going to. But I think that mostly people are driven by money. Money is a big deal for this.
It is very unfortunate because if I'm going to go to my primary care physician and I have a diagnosis of hypertension, and he said, you need lisinopril 20 milligrams. Okay, I need lisinopril 20 milligrams. I'm not going to argue with, he's the expert. Why do I know about lisinopril if I'm a patient, right? So the same thing happens with this aesthetic industry. Like, I'm not going to go to my injector and say, I just want 20 units of Botox for my platysma bands. Like, what that's going to do, right? So that's just, educating.
Talking about this subject, a lot of consumers, like I said, they're driven by money, so they never question how legit is this practitioner, because anybody right now can open a med spa,
Very
but
unfortunate.
do you have the credentials to run a med spa?
Yeah.
And it's just like this particular person in New York who was an esthetician who is not in their scope of practice to inject. Only physicians and trained licensed medical providers like NPs, PAs can provide these services.
And I think RNs in New York can inject, right?
Yes, RNs can
Okay.
inject in New York, but they have to have a medical director, such as physician or a nurse practitioner.
So that's the thing. This is very confusing because as a consumer, and I'm gonna put myself in a consumer shoes. Like every state is so different because in New York, an RN can inject, but in Florida, RNs cannot inject. But then in Texas, I heard stylists can inject. Like it's just
It's like a free for all.
oh, it's the wild wild west in Texas. Everybody, literally everybody can inject, and how safe is that? Like if I live in Texas and I want to get Botox and then I see this Instagram page of this person that claims to be an expert in Botox, I'm going to believe that person, right? Because they're Instagram, they're showing me expertise, but they're not licensed to inject. That's what's scary because it's very confusing for the consumer to know what's real and what's not real in this industry.
And that's a good point. So all these things are driven by social media because we have a lot of influencers out there who don't do their research, who don't take the time to see if this provider who is injecting um, these things in their face, are they real? Right. So how do you as a consumer know? There's so many resources. This is 2025. We have resource for everything. We are public.
We are, even our license is public.
Everything is public about us. So I sometimes feel that again, this is money driven and non-educating. If I say, hey Kimberly, I could do your lips for $200, and you're gonna say, wow, $200 is a great deal. But you're not asking me what are my credentials because your focus on is $200.
What do you get it for? Like for us, even our cost of a syringe of filler is way more than $200. Like my cost, like even if I want to give it to you free, and if I give it to you at 200, I'm sorry, it cost me more than 200 to buy a syringe of filler. How am I gonna give it to you for $200? I'm red. Like I'm not. This is just, that's how you know that that's an illegal product, that it is not coming from the manufacturers. And this is for consumers out there to know that the only FDA approved fillers, since we're talking about fillers, is called Derma, which is our Restylane fillers. We have MERS, and MERS have our, of course, Radius, but the Belotero as well. And then we have Alastin, Allergan, who has Juvederm fillers. And then we have our RHA fillers, and we have our Revanese fillers. That's it.
The safety is so important. So all our products in our country are FDA approved. So who is not to say that these products that are being injected in these individuals are, contaminated? Remember, they're not FDA approved. They're not stored correctly. So there are risk factors. Most people are driven by, how much. Again, I'm gonna stick to the how much because that's the really what drives people to do certain things like this. How much? And anybody can put pretty pictures on social media and say, I am a great injector.
I can go to AI.
Right. You can go to AI.
Create a
So,
picture of
right.
this.
Right. And for us, we have extensive training. We have to know facial anatomy. So when everybody posts these great things on social media, there's risk factors that come with it. You, as an injector, it is your responsibility to keep safe. Most places that are not legal, they don't have the things that you need in order to administer that syringe of filler.
And that's about education, but let's talk about how much money it takes to keep a medical practice open.
Right. I was going to get to that. Correct.
Electricity, malpractice insurance, general liability insurance that we need to carry in order to have our doors open and be compliant, OSHA, the fire situation. Like it's a lot to keep a medical practice open.
So patients are really paying when they see us. It's paying for safety because we need to have a malpractice insurance in order to keep you safe because we're doing legal things for you to be safe and get a good outcome.
And this is the thing about malpractice insurance and liability insurance. They are not going to give coverage to an unlicensed medical provider. So a hairstylist that is doing this legal stuff, something happened to you as a patient, they can't respond because they don't have liability insurance or general insurance, because they are not going to cover that hairstylist because she can legally do this. So all those places that are non-medical providers, they're doing this without insurance. And that's a red flag right there.
I just had a patient the other day in my chair and she says, do you do lip fillers? I said, yes. So she told me that, how much. I told her the cost. She says, well, I could get them for $250. People will risk their life. They don't think that injecting things that are not FDA approved, this can cause necrosis, they can cause death of your tissue. You can lose your lip, you can have damage of your
which is going to be more costly to fix.
right, because you want to save a few dollars.
People don't get that, and you know, I'm pretty sure you took anatomy classes, but
Not one time, 100 times. We have to continuously. It's a continual.
so it's a continuous thing, and learning aesthetics, people, this is expensive. This is an expensive career for us to be proficient in what we're doing. And a anatomy cadaver course can cost you anywhere from $2,500 to $8,000 for an anatomy cadaver course, which I have taken 3 times. It's not cheap, but I want the best for my clients. I want to keep them as safe as I can humanly possible do. So I practice on cadavers. And I don't care how much it costs me because it is knowledge no one can take away from me.
Correct. And that's it. And that's what we're driving. Education is so important for the consumers to understand that, us as providers, we are providing a service just to keep you safe and making sure that we are educated enough to produce a good product.
Every time I go to a conference, I post it on social media. I don't care. I might be taking a lip filler class, but I'm going to post I'm taking a lip filler class because I want my followers to know that I am investing on my education, on my knowledge, and what's new in the industry because I want to know. If lip filler is not a thing anymore, then what's next? I do want to know about that.
Right, and that's a good point you brought. You said invest. We have to invest in ourselves, educate ourselves in order for us to give good service to the patients. Um, and when you go see these websites or these places, there is not one certification on anybody's wall.
Not even, though these people don't even have websites.
Correct. And it is mind-boggling that I think people are aware of this, but they still go to places like that.
That's another thing. It costs money to build a proper professional website. So I'm investing on my website, on the security of the website, because if you put your information on my website, rest assured, no one will take that information and put it elsewhere because I am investing on firewalls. So no one can take that information from my website. That's another investment, that's another cost for us that we're doing things legally. And if you go to my website, you'll see my certifications, you'll see my diplomas, because I want to be truthful. I want you to know that I'm board certified, aesthetics, functional medicine. I feel safe going to a provider that has all those certification and the school they went to in their website because they're being truthful, they're being transparent. I'll go to you. Hands down, I'll go to you. Versus these people that are doing the famous hyaluronic pen, which is not FDA approved, everybody, and they don't even have a website
Nope.
because they're cheap. Cheap is not always good.
And I think sometimes too, just to play devil's advocate, that sometimes, let's say consumers look for a very special. But once they're in their chair, now they're seeing things. They're a little bit skeptical, but they don't have that. They don't want to ask because they don't want to feel that they're questioning the person who's going to inject them.
No, you have to ask.
You have to ask. It's your right. You can question, where did you get where did you get your diploma? Where did you get your certificates? What products are you using? A lot of the counterfeit products look very much so to the color scheme of the real.
The color scheme. Also, there's the face sculptura. I made a story about that. So this is what happened. I'm not gonna say the name of the practice, but a practice followed me on Instagram. I was like, oh, I have a new follower. How exciting is this? And I went to this profile and I started scrolling down, and this person was proudly putting pictures of the product that this person uses on that person's social media. And I raised he. The person posted a picture of the sculptura that this person was using. And it's not the sculptura that is FDA.
The audacity of them to even post things, like they have like no remorse. They don't care.
Because, hey, if I'm doing this illegally, Okay, I'm gonna do it behind I'm not gonna post it on social media.
And how many times these places change their name? Oh, because they get caught. So here's my question. If you catch these folks doing this, why do they have the rights to change the name of their business and continue to do the same offense? And if people know about this, why are they still going?
Because they can open social media.
I mean, $250 versus the rest of my life trying to fix my face.
Talking about that. I posted that on social media not so long ago. The patient that came to the practice and she had a BA, like a vascular occlusion of the lip because she got a hyaluron pen injection. They call it the needle-less lip filler. Needle-less. So let's think about that for a minute, which infuriates me honestly when I see this in social media, because they're even putting the pen and pressuring, like they're pushing the filler into the mucosa of the lips. Like, you know how delicate the mucosa of the lip is? And you're pressurizing. Yeah, so you're pressurizing this hyaluron pen into the mucosa of the lip. No wonder why people get vascular occlusions out of that. And then they come to us for us to fix. Because the people that were doing it, they don't even have Hylenex. They can't even purchase Hylenex because they don't have a medical license.
Right. So let's talk about that. Most patients or most folks don't understand that fillers can migrate and cause occlusions if you don't know where to place them. Can that happen? Yes. Now, it can also cause blindness. I don't think they're aware they can cause blindness.
I explain that whenever I have a new client in my share, and I do a consultation. Like, even if you're coming here for neurotoxin, I'm gonna sit down, I'm gonna look at your face because I think this is important to look at you holistically. What can we do to take care of your skin and to your face and your anatomy? And people think it's very safe to inject fillers, but in reality, it's a viscous substance.
It's a skill.
And one of the first, besides the lips, one of the most famous place to put filler is on the nasolabial folds. You know how scary the nasolabial folds are to inject?
Right. And these folks are just injecting like nothing. It takes years for us to learn this anatomy and to be on top of our game to do good. And these folks are just injecting like it's okay.
That's why in my injector, like in my injector room, I have a picture of arteries, veins, nerves, and everything because I use that to educate my patients. The facial artery, you know, you run so close to your folds, so freaking close. So God forbid I occlude the facial artery with hyaluronic acid and I didn't realize that soon enough. That's it. You can get blind.
Necrosis, about on top of being blind, your tissue could become necrotic.
Your tissue can die.
Right. It dies. Right. You're right. Now you need months of like yeah, right.
Hyperbaric chamber, which is not covered by insurance. Like the recovery of these mistakes that can be avoided if you go to someone else what they're doing. It can be thousands and thousands and thousands of dollars to fix that mistake because you wanted to go to a place that was giving you a syringe for $200.
Mm-hmm.
Counterfeit things. I had a patient not so long ago. I don't know if this has happened to you, but I had a patient that was a new consult. She actually told me, I've been following you for 2 years. But I am the type of person that I like to see what you're doing. I like to investigate who you are before I go to you. So she told me that she been following me for 2 years and she never DM me, no comments, nothing. She's like, I was like a ghost, but I was seeing your every story and your every reel and your every post without commenting or anything. And she said, I finally decided to come to you because you convinced me of what I need to do. And I said, so what happened that I didn't convince you soon enough? And she said, I went back home, Puerto Rico, where I'm from and where Janice is from, but that's redundant. So she went to Puerto Rico and she got invited to a Botox party. So she went to this Botox party that it was actually in a hotel room in San Juan. And she saw this person that was injecting Botox, fillers, whatever it is, and she decided not to get injected. She's like, I'm not gonna do this, which was great. And she told me, I didn't do it because I've been seeing your videos. And you're always saying if the person cannot show you the bio, the product, expiration date, where is it coming from, not to get injected. So she's like, I thought about you, and she decided to not to get that done. But her friend did, and she had a complication from a lip filler.
Complication exists if people are not trained. You know, when I am doing my Botox or any procedures, I always do it in front of the patient. I want them to see what I'm doing. I want to show the vial. Always, it's so important for them to have credibility in what you're doing. And but you know, if you keep going to these places, you're going to have long-term damage or complications that you may not be able to fix ever.
Exactly. So she came, and we did the consult, we did a treatment plan, and now she's in the road of getting the Botox and collagen simulation. Awesome. And like she was happy, and that made me kind of think about what's going to happen with these people that don't really get educated about what's real and what's not real. Because let's face it, you see all these things in social media and you have no idea what's real and what's not, and that's unfortunate.
It's going to continue to happen. It's our job to continue to drive that point that, you know, education, ask for certifications, ask for to see the vials, you know, question your provider, question the injector. It's okay to question. It's your right. You're paying.
I actually like it when I get patients in my chair and they ask me all these questions, and I'm happily answering the questions.
Same here. I feel the same way.
There was actually a patient. We were talking about biostimulators last year, and then she was talking to me like, "What do you think about Bellafill?" To be completely honest with you, Janisa, I had no idea what that was. I'm like, "What is?"
Either.
You don't know? So just like, what do you think about? Because she wasn't sure if she wanted to do Sculptra or Radius.
Okay.
And she's like, but I heard about this Bellafill, and I'm like, what is that? There's only two biostimulation that are FDA approved. I was so sure, Jenny, so sure about that. She's like, no.
We talked about this.
She's like, no, it's FDA approved. I'm like, I don't believe you. So I went online, quick Google search. So there is a third biostimulator that it is.
We talked about this. I remember now.
I was like, I'm sorry, but a patient educated me, and I am okay with that because now I'm a better person because I learned something that I had no idea what it was.
That's good. That means that the patient is doing their research. That's what people need to do.
I agree 100%, but I don't like Bellafill anyways. I like Sculptra and Radius better, but anyways, that's redundant.
Yes.
You saw that. I mean, I know we're both from Puerto Rico, so I might make a lot of analogies back home. It was a ship that was entering Puerto Rico, and it was full of counterfeit medications and Botox. They were actually able to stop it, so it actually didn't enter Puerto Rico, but it was a ship full of counterfeit Ozempic, counterfeit Botox. I was like, well, I'm sorry for those person that lost the money because you didn't get your product, but I'm happy about that because of safety for my.
It's just, I think it's horrible. Like I said, you know, in this time and age, we have the resources to research your injector, and people should start doing that. It's so important. For the record, we as providers always also do sales, but we are licensed providers, and we do it as to give back to the patients, not because, you know, it's okay to do it. We do it as a give back.
I'm as a consumer, if I'm looking at Instagram, Facebook, etc., and I'm looking at your feed and on your bio, and I don't see letters behind your name, I'm not gonna go to you.
Keep scrolling.
Keep scrolling. Right. And that's a red flag right there, honestly. If you go to a feed and you only see Botox, you have just a name, and then on the bio it says Botox, fillers, needleless, lip fillers, but no name, no letters behind the name. Run away.
That's a big problem.
That is a problem. You are not going to see a licensed medical provider not putting the letters behind their name. And honestly, because it's cost us a lot of education and money to get those letters behind my name. So I'm going to proudly put those letters behind my name.
Absolutely, absolutely. I feel the same way. I put my my initials every time, my credentialing every time. They need to know. They need to know. It's important.
So what would you say to someone, I have 3 minutes, to someone that DMs you and right away ask you, what is your price per unit? Or what is the cost of your lip filler? Like how would you address that question?
I always tell them you have to come in for a consultation. I need to see you. I need to talk to you
But I'm a patient and I'm gonna ask you, why do I have to see you for that? Can you just tell me the price?
because it's important for me to make that evaluation before I give you a price.
Exactly.
I charge per unit. I don't know what you're going to need. So you have to come in. I like patients to come in. I don't like to give prices over the phone. Do you call do you call the plastic surgeon and said how much is the setup going to cost me?
If they go to a shitty place, they will. Um, or you're not gonna go to your dermatologist and ask them how much is gonna cost me a biopsy of this mole that I have on my forearm.
Right.
And you want to go and be seen. Yeah, you want to be seen because you might need maybe 1 syringe or 2 syringe of filler. Like I don't know. I need to know what do you want? What results do you want so I can properly tell you how much that's gonna be. Well, if it's for me, I'll keep talking, but I have a minute left to finish our conversation. For our viewers that are out there and new viewers, thank you for definitely being here today with us. And I hope that this was educational for you and this episode helped you make better choices when it's come to treatments in your face and injectables. Thank you, my loves, for visiting me and being
Thank
part
you
of
for
my
having me.
podcast.